They're looking at on this graph is the reoccurrence rate of back pain within 1 year and 3 years. So that's the percentage of people on the y-axis or the vertical axis that had a reoccurrence within 1 year and 3 years. Okay. You'll see that after 1 year, if you've done core stability work, it decreased their chance of relapse back pain by more than 50%. And over 3 years, it decreased their chance by approximately 50%. Which, if you can get people decreasing these chances of relapse, if they come to you for rehab, then you're more likely to keep them training, get them achieving their goals. Okay? The transverse abdominis, it's a muscle we'll cover in particular soon. As I said, it's a muscle that runs deep down in your stomach, over the front of your body. They did a study here looking at patients with chronic low back pain. So you've had back pain for more than 3 months, constant back pain, all right? They put these patients into 3 treatment groups for 8 weeks. The first one, they did some core stability exercises. The second one, they just did general exercises. And the third group, they had hands-on therapy. The outcome they're looking at is, can you change the size of the transverse abdominis muscle? Okay, and they showed that with specific training, you can improve the size of that deep stability muscle, the transverse abdominis. Okay, and you'll see it has the baseline there in blue, and after training, it's increased in red. If you did those people that had that chronic low back pain, they're actually the effect of this muscle, this transverse abdominis, actually decreased in size if it wasn't specifically trained. I'll touch on that a bit more later as well. In terms of lower limb injuries, there's good evidence again that can contribute to decreasing lower limb injuries. It's just kind of like building blocks. When you're building a large building, you need good foundations. Okay, it's kind of what happens around with your core. Okay, if you've got good foundations, then it can put less stress on the lower limb. Okay. Again, we'll touch on that shortly. Just briefly, the study they did, that first one, they did 277 athletes in a college in America. They recorded their knee injuries over 3 years. Okay, so they initially measured their core stability. Then over 3 years, they took note of the injuries that they had. They were looking at the relationship between core stability and knee injuries. Okay, they found that it was 3 times more likely to have a knee injury if you had poor core stability. And the second study I haven't looked into quite as much, but again, I think this is more on female athletes. They looked at their core stability, and they did some core stability training for about 8 weeks and decreased their knee injury incidents over the next couple of years compared to those who didn't do core training. Okay. So what I'm actually talking about with core stability, okay, I'm talking about optimal motion control at each spinal segment. So each segment of the spine provided by careful coordination of muscle, ligament, and bone structures. An optimal core will allow you to perform functional and sporting tasks a lot better. Okay? It also allows an optimal core will allow you to have good stability, as well as provide shock absorption when you move, to allow you to move, and also provide balance. One thing we can affect there is your muscles. You can't necessarily change your bones through training. I liken core stability to a tent, so roll with me on this one. Basically, your spine, like a tent, has guide ropes, alright? So the guide ropes are like the muscles that support your spine, okay? They keep it stable, alright? They allow the guide ropes on an optimal tent or an optimal spine will not just be too tight, okay? They will allow a little bit of movement in the wind or when you move, okay? If you have a lack of, if you're really flexible, these people up in the top corner, if you're really flexible, lax people, your tent may collapse or your stability, you can have injuries in your back and your lower limb. Okay? Some people you can tell if they're too flexible, you can do those Carter Wilkinson flexibility tests, where basically you get people to You know, can they bend their little finger back to 90 degrees? Can they touch their thumb on their hand? Do their elbows hyperextend? Do their knees hyperextend? Can they put their hands on the floor? You've got people that rock up to your treatment rooms and your training and they can do all that. They're really flexible people. They're people that need that stability, not necessarily heaps of flexibility work. Okay? At the other end of the scale, you've got these people that are really stiff and they kind of move around a bit. You can see them around the gym. They need to be stable, but for good stability, you need to have movement as well as stability. Okay? So sometimes these people, the support structures get too tight, okay, and too rigid. Okay? You can get rips in your tent, all right, if those guide ropes are too tight, which is just like tension spots on your back or on your body. Okay, and they can get back spasm and that type of thing. You also see those people that are really stiff. Sometimes they'll have good outer unit core stability. So those outside muscles, all right. People will brace really heavy when they're lifting heaps of weight, or when they're squatting, or when they're moving. Okay. Now these people sometimes using all their outer muscles of their body to hold their core together. I see, but these people can get injuries sometimes by doing simple things, by just bending over and picking up the paper. I've seen about 5 back injuries in the past 5 days coming to my treatment room. 4 out of 5 of them have injured their back just by doing simple stuff. Okay? Because that, usually if they're people that just brace their whole body when they're doing big exercises in the gym, then they're just an injury waiting to happen if they've never done their deep core stuff. Okay? I'll explain a bit more as we go. Where we're at today, so there's different aspects of what I call core stability training. Okay. Generally, if I had my ideal way, I could take people through a rehabilitation or even rehabilitation. I'd look at their alignment first. You know, do they have good posture? Do they have good movement in their joints at the first level? The second level, I'd be looking at deep core stability in your inner unit, deep down into your spine and your pelvis. Then after that, after you've done your inner unit, those deep stability muscles, then you look into those outer unit exercises, looking at your larger muscles in your body, okay? And then finally into functional and sports training tasks. Today I mainly look at the inner unit stuff, all right? I've run a whole 4-week course with 2 hours each session on the whole lot. Today we're just doing inner unit, okay? I've seen trainers are great at level 3 and 4 outer unit stuff. You guys come up with great exercise in the gym, you know, twists, sit-ups. I mean, you get as great as you want with pulleys and Swiss balls and rollers and things like that. Okay. Today will be a little refresher on the other stuff. A lot of clients will want to get straight into the, you know, they see people flying a Swiss ball, crossing cables over, that kind of thing. They want to get straight into that. So sometimes there's a education for the client if they've had previous back injuries or lower limb problems, because they may need to do some stuff. Just going to touch on some anatomy, okay? I realise that everyone will be at different levels in their anatomy. I'll try and keep this relatively simplistic. I'd encourage any of you to look a bit more into this. If you don't know so much about around the core region, it's handy to have a bit of a read. Most of it. Talk about the difference between local muscles and global muscles. Okay? So local muscles, just looking on that bolded side, you have these on your sheets as well. They're usually deep down, close to the spine, on the front and the back and the sides of the spine. These muscles, you know, muscles in your body, they don't just do like flexion and extension tasks. You've got muscles that work constantly throughout when you're moving, okay? So it's not all about power. You have stability muscles that work all the time, okay? That's what these